Hello everyone. In this session, we would be covering all the miscellaneous RNA viruses in brief. Starting with rodent-borne viruses. Now, rodent-borne viruses, or also known as the roboviruses, as the name suggests, they are transmitted from rodents to man when they come in contact with any infected body fluids or their excretions. There are two viruses in this class, arenaviruses and hantaviruses. I guess you are quite familiar with this word hantaviruses, which is one of the most commonly heard name after the COVID viruses. It belongs to family Bunyaviridae. Obviously, the reservoirs in this are the rodents, and the transmission of this virus is through inhalation of aerosols. Coming on to the clinical manifestation of the hantavirus. Hantaviruses causes two fatal diseases. First is the hemorrhagic fever with renal syndrome, which is characterized by interstitial nephritis, as the name suggests, the renal syndrome, followed by hemorrhagic fever and shock. And the second is hantavirus pulmonary syndrome. The primary rodent reservoir in case of hantavirus pulmonary syndrome is the deer mouse. Just to mention one thing, in between all this coronavirus outbreak, China has reported hantavirus in the country. Coming on to the next class, that is the filoviruses class of virus. It has got two genuses, Ebola and Marburg viruses. Filoviruses are pleomorphic and they resemble long filamentous threads. We shall see something regarding the Ebola virus. Now, Ebola is a highly fatal virus leading to fatal hemorrhagic fever. Coming on to the history of Ebola, the first outbreak occurred in Africa in the year 1976. There were two simultaneous outbreaks at that time, and the second outbreak occurred in a village which was near Ebola river, and hence the name of the disease is Ebola. Thereafter, there were several outbreaks in African countries, and this disease is majorly confined to this area. The most recent outbreak that has occurred in Africa was in the Democratic Republic of the Congo, which was in May to July 2020, where 8 cases were reported and 4 deaths. And one of the largest outbreak that has occurred was in 2014-16, that is also called as the West African epidemic, where almost 28,000 cases were reported and 11,000 deaths. The reservoir hosts for Ebola viruses are unknown, but they are suspected to be infected animals such as fruit bats and primates. In every outbreak, Ebola virus is introduced into human population through close contact with the blood, secretions and other body fluids of such infected animals. Clinical manifestations. Common symptoms are fever, headache and abdominal pain, rash, which is then followed with hemorrhages leading to shock and death. The next class is Reovirus. Now, Reoviruses can infect the gastrointestinal system as well as the respiratory tract. The name here, Reo, is basically an acronym for respiratory, enteric, orphan. Can infect the respiratory system as well as the GIT. The word orphan here means that some of these viruses, some of the viruses of the class Reovirus, they have been observed to be not associated with any of the known disease and hence orphan. One of the common virus or one of the important virus of this family, that is the Reovirus family, is rotavirus. Rota, which is basically a Latin word which means wheel. It is based on the appearance of the virus. The name is based on the appearance of the virus. and it is one of the commonest causes of childhood diarrhea. Clinically, it causes human infantile gastroenteritis. 50% of all the childhood diarrhea are caused by rotavirus. And epidemiologically, 1 million deaths are reported per year because of rotavirus. And these deaths are majorly reported from Southern Asia and Sub-Saharan Africa. Also, there are 2 live attenuated vaccines available for rotavirus, Rotovac as well as Rotarix. The next is the Borna disease virus, which is a highly neurotropic virus, that is, it is associated with the neurological tissue. The disorder caused by it is immune mediated, which is characterized by deposition of the inflammatory cells in the brain. Human infection has not yet been established, but the serological data suggests that it might be associated with neuropsychiatric disease and schizophrenia in humans. Now we shall see the clinical manifestation of this disease, measles. Measles is a febrile illness with an incubation period of 7 to 13 days. The disease is divided into 3 stages: prodromal phase, eruptive stage and post-measles stage. In the prodromal phase, the symptoms that occurs are high fever, triple C, that is cough, coryza and conjunctivitis. Coryza is basically inflammation of the mucous membrane of nose, and photophobia. In the prodromal phase, there is a very important finding, that is the Koplik's spots. Koplik's spots are pathognomic of measles and they are seen on the mucous membrane. The most common mucous membrane that is involved is the buccal mucosa. These spots are white to bluish and surrounded by an erythema. They also resembles the grains of salt surrounded by a red halo. Then the second is the eruptive stage, wherein exanthema is seen, maculopapular, dusky, red rashes. They appear after 4 days of the fever, that is on the 14th day of infection. These rashes typically first appears on the ear and then it spreads to face, arm, trunk and the rest of the body. And the third is the post-measles stage, which is characterized by weight loss and weakness. There may be failure to recover and then gradually patient deteriorates into chronic illness, wherein the patient mostly ends with pneumonia. 60% of the deaths which are caused by measles are caused by pneumonia because of that. Now seeing the complications of measles, post-measles encephalitis, subacute sclerosing panencephalitis, giant cell pneumonitis, also known as Hatch pneumonia, and secondary bacterial infection. You can see the picture of Koplik's spots, salt grains surrounded by red halo. Picture of measles rash. Next is the mumps virus, which is again a common virus seen in children, and it majorly infects the parotid gland, leading to viral parotitis. Mumps virus is transmitted through respiratory tract. It then spreads to the local lymph nodes. Following spread to the distant lymph nodes and spleen, enters into the blood causing viremia, and then its target sites, it spreads to its target sites. The major one is the salivary gland, and the others are testes, pancreas, ovaries, mammary glands, and central nervous system. Half of the people who are infected with mumps virus, they either are asymptomatic or they present with some non-specific symptoms like fever and anorexia. But this is more common in adults than in children. In children, the most common presentation is bilateral parotitis, as you can see in the picture. Bilateral parotitis, which is an acute non-suppurative parotid gland enlargement. Also, other clinical manifestations are epididymorchitis, aseptic meningitis, oophoritis, pancreatitis, and atypical mumps. The next family is the toga virus family. One of the important virus of this family is Rubella virus, causing the disease rubella. Rubella is one of the classic childhood exanthem, as we have seen earlier. The 5 classic childhood exanthem comes from a Latin word which means little red. The rashes that it causes is quite similar to measles, and hence it is also called as German measles. And remember that rubella is highly teratogenic and it can present as a congenital infection. Also, rubella is a part of the torch complex, as you are all aware of the torch complex: Toxoplasma, rubella, cytomegalovirus, and herpes simplex. It is one of the torch infections. Now, the vaccination part of these 3, that is the measles, mumps, rubella, there are combined vaccines available for these. The first is the MR, that is the measles rubella vaccine, MMR, that is measles, mumps, rubella, and MMRV, that is measles, mumps, rubella with varicella vaccine. Next is the rhinovirus, which belongs to the family Picornavirus. Rhinoviruses are the most common cause of common cold. Then comes Coxsackieviruses, also belonging to the family Picornaviruses. It is named after the place of its discovery, that is Coxsackie village in USA, hence named as Coxsackieviruses. It produces variety of clinical illnesses like aseptic meningitis, herpengia, hand-foot-mouth disease, and pleurodynia. Hand-foot-mouth disease is characterized by oral ulcers and rashes in soles and palms, which heals without crusting. Next are the Nipah virus. Nipah virus are the zoonotic paramyxoviruses, and the reservoirs of this is the fruit bat. If we talk about Nipah virus in India, outbreaks have been reported from West Bengal and Kerala. There were 2 outbreaks in West Bengal and the most recent outbreak was in Kerala in Kozhikode in the year 2018, where there was a cluster of 18 cases, amongst which 16 of the patients died of Nipah encephalitis. I would like to mention one thing here, that there is a very beautiful movie named as Virus, also available on Amazon Prime Video. This movie is based on this Kozhikode outbreak of Nipah virus. Please go through it. It is a very beautiful movie. And the clinical manifestation that Nipah virus causes is encephalitis. The last is respiratory syncytial virus, that is the RSV virus, which also belongs to the paramyxoviruses family. This virus is most common cause of lower respiratory tract infection in infants. To begin with, the disease causes symptoms like running nose, fever, cough, wheezing and dyspnea. The infection is very severe in the premature infants. And in adults, it causes influenza-like symptoms like common cold, running nose, sore throat and cough. And these infections are common in the overcrowded communities like military recruits. Thank you.